Welcome to Toledo Clinic TV. Our guest is a urologist, Dr. Omar Khan. Thank you so much for being with us.
Pleasure to be here.
And today we're going to talk about BPH. What exactly is that?
So BPH is basically an enlargement of the prostate. And what happens is it causes some irritation and difficulty emptying the bladder. For men, as they age, their prostate usually gets larger. So about 50% of men within the age of 50 or 60 will have signs of an enlarged prostate.
And what are some of those signs? What symptoms would they experience?
So most of the most common symptom that people see is frequency or having to urinate a lot, usually at night, but also during the day, 30 minutes to every hour or maybe every 2 hours during the day. Sometimes men will exhibit symptoms of not feeling like they're emptying their bladder, or having a weak stream, or having some dribbling after they finish voiding.
And how common is this? I mean, you see this in...
Oh yeah, we see it. I think actually a lot of the times men don't really, they try to ignore those symptoms, or they just think that it's a normal part of aging. But I like to ask men a lot of the times, do you feel like you're voiding as well as you did when you were younger? Mm-hmm. And we see that the majority of men are like, no, definitely not the same way I did when I was younger. And that's why 50% of men over the age of 50, and actually almost 90% of men over the age of 80 will have, symptoms of an enlarged prostate.
It's a benign condition, so it shouldn't be confused with cancer.
Yes, so yes, it's a benign condition. There's cancer, and then there's an enlargement of the prostate. So this is not, they're two totally different things, because you can have cancer and not have an enlargement. But yeah, this is a total benign process, but some of the problems that arise from having an enlarged prostate are not just from symptoms, from bother symptoms that are benign. You can get infections, you can have kidney damage, you can have some problems with the function of your bladder if your prostate gets too enlarged. So there are definitely some, medical problems that can arise that are not benign if you ignore the symptoms of an enlarged prostate.
What's the course of action? They come and see you. Is it easily treatable?
Oh yeah, so usually what we do is we start with medications if they need them. If medications don't work, we'll do a trial of that, and if it doesn't work, then there's some minimally invasive treatments that we can do. Sometimes we will kind of core out the prostate and laser the prostate to make the urination easier for them. And then sometimes if they have very enlarged prostates, we'll even do some robotic surgeries or more invasive surgeries to remove larger portions of the prostate gland.
And are there side effects that come with that?
There are side effects that, with any therapy, from medication all the way to, larger surgeries, there are side effects. So we counsel patients on each and every side effect every step of the way, because they're different depending on what treatment that they get.
So not something to worry too much about, but something that needs to be taken care of if it's a problem.
Yeah, absolutely, absolutely. I think that this is something that I think a lot of men ignore, but I think that once they do get treatment, they realize that how much their quality of life improves. So.
All right. Thank you so much. Good information.
Thank you.
We'll be right back.